Hi, everybody. Wanted to talk a little bit about ultrasound, musculoskeletal ultrasound, as far as a tool that is very helpful when I'm doing some of the injection work that might be advantageous to have a second pair of eyes. When originally trained at the University of Wisconsin at the Hackett-Hemwall-Patterson Foundation School, we were trained to predominantly rely on our manual skills, which I think is still a very potent, powerful tool. And the training there has continued to emphasize using hands-on surface anatomy and anatomy knowledge in order to help guide our injection work. Now, there are times when we really prefer and would love to have the ability to be as precise as we can, which it sounds like an obvious, appropriate tool to have, but sometimes you're in areas where we have been in third world countries where ultrasound capacity and capability is just not available. So it really helps to make sure that you know, and as we were trained, to have that anatomy well under control before we would go to clinic. Since those days of learning hands-on technique, ultrasound has really gained popularity, and as recently as a course on the benefits of point-of-care ultrasound, as it is termed in family medicine, also emergency room medicine, where ultrasound capacity can save a lot of time and possibly even additional testing if ultrasound imaging can show you what it is that you need to know. In my own office, I'm using musculoskeletal ultrasound in order to help in areas that sometimes, because of the patient's body habitus, it might be a deeper joint, particularly hip joint, or it might be a difficult to access joint in some of my patients that have accelerated and more advanced arthritis, particularly with shoulder, when I'm looking at getting solution into the articular space of a shoulder joint or knee joint, which should be pretty straightforward, but there are times it may be more difficult because of previous instrumentation, previous traumas, more advanced arthritis where the joint space is more compact. So with ultrasound guidance, you can see much more clearly the target that you're going for, and I'll demonstrate this with a short video clip and with some imaging in my own office. What you'll see is a short video clip with the needle in a kind of a linear position, which shows up as a white line. You can see the needle moving and the needle tip in position in the interarticular joint space of the patient's knee, and then a still picture with an arrow drawn to the needle, so it's hopefully a little bit clearer. Hope that helps. Examples of partial tears in tendons, it's obviously much more advantageous to see the needle tip right in the structure that we would want to have the solution injected into, or around, for example, a tendon or a peritendinous sheath. There are times with hydrodissection of nerves that area is clearly elucidated with ultrasound imaging, and then you can real-time see the solution going right into the area that you want it to go into. This helps really magnify the emphasis on location as well as the benefits of the injection itself, so we're spot on to the targets that we want to make sure that we're treating. So if there's any questions about ultrasound, please feel free to ask, but these are sometimes areas that would seem pretty straightforward when looking at the surface anatomy, and sometimes we've been stymied with either, for example, getting a dry tap from a knee that you would think that there's plenty of fluid there, but sometimes it might be easier said than done. With ultrasound, it's a lot easier to see that fluid and a lot easier to see where your needle is being advanced right into the area of concern and getting the job done, either with removal of fluid or very often putting solution in that may help with tissue regeneration and pain management. So that's a little bit about ultrasound.